Hello everyone and welcome to this video. I am Mohammed El Sayed. I'm a radiology consultant and I'm the co-clinical lead for radiology at BHRUT. In this video I'm going to share with you the new radiology request form that we have produced recently, and we are looking forward to working with you to make this a big success for radiology and the trust on improving patient safety. Although we are very close from the electronic ordering and order.com, we thought that it would be a safe and a good idea to come with this radiology request form. This is to help us to improve our safety within radiology and within BHRUT. We need your help in using and implementing this radiology request form so that we can move to a different era of having patient safety at the core and the center of our care. This radiology request form has been approved by the Divisional Directorate and has also been approved within the clinical reference group chaired by the medical director. The reason why we think this is an important step towards improving patient safety is that we've had a couple of incidents recently within radiology, and we need to make sure that we change our approach on dealing with such incidents, that we come with an action plan and we actually do it and implement it and test it with clinician within the trust. I'm now going through to highlight some of the changes in the radiology request form. So this is the radiology request form that you're all familiar with. There is a clear sign here and a message saying that incomplete eligible forms will be returned. We really encourage you to put as much as clinical information in this clinical details relevant history box to enable us to take the right decision about what type of contrast to use or what examination should the patient have. You also have here a couple of lines referring consultant. It doesn't really help us in radiology if only mention your name, because for example there are 5 co-workers in the trust, and if you write co-worker then it can go to anyone, and if there's a cancer which goes to the wrong consultant with the name of co-worker where he's not expecting to have a cancer or doesn't even look after this patient, I'm sure you can all imagine that this patient can have significant delays in her or his treatment pathway. We have had an incident where a request form was assigned to the wrong surname. For example, we had the surname as Smith and was assigned to the wrong Smith. We also require to have the referring department, and it's mandatory now to have the GMC code for the referring consultant. And unfortunately, once we implement this radiology request form, all request form that hasn't got GMC number for the referring consultant would be returned back because it will be considered as an incomplete request form. So it's mandatory now to add the referring consultant GMC number. It's also important to highlight which clinic or ward this patient referral is coming from. As I mentioned before, writing all clinical information does really help. Abbreviation is not encouraged, and we would like to stress that 50% of our radiology report conclusion can vary depending on the clinical information it provides. So use this and to write as much clinical information as possible. These are mandatory forms that you're familiar with, which is hospital number, NHS number, surname, phone name and address. I'm not going to go through details. Clinical question, it would be helpful to know what's your real clinical question so that we can tailor our radiology protocols, whether it's CT or MRI, to what you need to give you the right answer. And here you would write what you would suggest as required imaging from your point of view to give you the answer. Now this is a new section being added here, whether you think the contrast is needed or not. I think that most of the referring consultants are aware of when to use contrast or not, and this is really important because some patients, they need to have consent about having a contrast, and the only time where this can happen is during the consultation, whether it's face-to-face or Zoom, or whether it's over the phone, because leaving it till when the patient comes to radiology is leaving it too late, and it doesn't really constitute to a meaningful consent. And it's also important to consider other risk factors while you are requesting the scan. So if the patient is above 75 with multiple comorbidities like heart failure, high blood pressure, diabetes, and hypertension, and on nephrotoxic medication, and consulting with the patient so that he or she can decide whether it's really valuable for this patient to have that type of scan, going through the risk of having contrast-induced nephropathy. Now this is also the new section, if the scan is trauma related or not trauma related, and this is really helpful to us. We've had an incident where the patient had a CT scan of the head where this wasn't highlighted on the clinical information. Patient had a trauma, had a bleed, wasn't highlighted to the trauma pathway. Patient hematoma kept on growing in size, caused herniation, and eventually sad outcome for this patient. We don't want any patient to come to harm when they come to our organization. Therefore, this is collaborative work between radiology and all clinicians to help us identify the vulnerable patient having trauma. The referral status, I think this is not new, and we all encourage the referrer, if he is not the consultant, to write his GMC and contact number as well. And when we highlight here contact number, some would write an extension number, some would write a bleed, some would write a DECT. So it's good if you could advise your team to circle which one they are using, because there's no pointing of us calling a bleep number thinking it's an extension where it's actually a bleep number. It doesn't help communication. We're not going to go through the patient transport type or ambulance, or if the patient is pregnant or not, but this is something that you have to go through, and each tick box need to be ticked on the radiology form, otherwise it will be considered as incomplete and will be returned back. So please take your time to familiarize yourself with the new request form and make sure you're ticking all the boxes to avoid any forms being returned back because they are incomplete. Again, this is a very new section that has been added to improve our safety within radiology and the organization, and it became necessary to add this section after we've had 2 incidents in radiology where contrast-induced nephropathy was caused for having significant patient harm. So please familiarize yourself with this section here. I'm not going to read it, but I think it requires you to read it, and you make sure that you're aware with your team that any patient with EGFR of less than 30 for outpatient referral and creatinine of more than 150 for inpatient need to have clinical to renal physician discussion or to radiologist discussion, depending on the time this scan is being referred. This is clearly demonstrated here, and if you have any questions, please ask anyone and member of radiology who could give you more explanation on this section, but I think it's self-explanatory. This section here as well contains some of the new questions, so please make sure you ask every question by ticking yes or no on these questions, as these will help us to identify patient at risk of developing post-contrast acute nephropathy, and it's important that we highlight this to enable you having a scan in a timely fashion, because if any of these is not ticked, it will unfortunately result in the scans being returned back, and this will result in delaying your patient care. For patient who requires MRI scan, there's another smaller section need to be added there, and due to the COVID era we're in right now, we need to make sure that this section is also completed in a timely fashion. So once we've got a complete request form, we will then process it, scan it on the system, and do the scan. Otherwise, incomplete or eligible forms will be returned in line with BHRUT 2017 regulations. I'm really asking for your help in radiology to help us to improve our services and to help us improve our safety processes within the organization. Without you, all clinicians, engaging on this, we won't be able to do it on our own. So we are asking for your help and support on making this a success as a small step in improving patient safety during their treatment journey within this organization. And thank you.